Welcome back to TV5 News at 9. It's now time for Medical Moments with Covenant Healthcare. Joining us this morning, we have nurse practitioner, our great friend Sandy Haddad-Duke. Good to see you again.
Thanks, Sierra. You too.
Yeah. So we're talking about bowel issues and a specific one in particular. Tell us a little bit more about it.
Okay. So we're going to be talking more about fecal incontinence today, which can be a very embarrassing topic for patients. So I want to preface it with that. What it is the inability or impaired ability to control your bowels, your stool, and leakage of gas. And patients tend to shy away from this conversation because it's something that can be embarrassing to bring up. But what I want the viewers to know, and what I always want my patients to know, is this is actually very common. It affects about 21 million Americans. And the thing is, it's treatable and it's manageable.
So tell us, what are some of the factors that may put people at risk?
So the biggest thing is women who have children, people who have tearing during delivery, and sometimes, unfortunately, you don't see those things until later on in life. The second most common thing is as we get older, the muscles get weaker, we lose muscle mass, so that in combination with a traumatic birth can cause that to happen. Other things that patients can, relate to this is if they've had injury or trauma to the area, that can cause some fecal incontinence. And then people who have had neurological diseases or, unfortunate events like strokes or spinal cord injuries can deal with this.
And tell us, are there any type of warning signs or symptoms that people should watch out for?
So the typical things that we see from our patients is the first complaint is a fecal urgency. So they're rushing to the bathroom, they can't make it in time. The second most common thing is people who excessively wipe. They feel like they can't get clean because they're constantly leaking stool. So those are the two common things. But what I want people to know is if you notice anything in addition to this. So if you're noticing blood in your stool, if you're noticing that you're losing weight unintentionally, if you're noticing that you're having low energy levels, low appetite, things like that, those are concerning and should be investigated a little bit further.
And what treatment options are available to people who may be dealing with this issue?
Yeah, so we have non-surgical options and surgical options. Our non-surgical options, there's three big ones that we focus on. The first is incorporating a high-fiber diet. Then sometimes we can do certain medications based on the consistency of the stool to try to bulk it up. And then pelvic floor physical therapy is really popular and very common and very helpful for patients. But sometimes that's just not enough and we have to move into our surgical options. So the standard of care in the country is actually called InterStim, or peripheral or a nerve stimulator. And what it does is it helps communicate with your brain and reminds your brain to do what it's naturally supposed to do, which is hold on to the stool. And this is really cool because one, we see great success with it. It's about 89% effective for these problems. But two is we do a 1 week or 1 to 2 week trial period where patients can see if this is actually going to help them before we do a permanent placement. And it's just a small little device. It goes in your lower back. And it kind of works like a pacemaker for the heart does. So this is really cool and really advanced, and it's been around for a long time, and it's the standard of care in the country. So
nice. Anything else you want to add?
For my patients who deal with this, or those who are watching that deal with this, don't be afraid to come in. I'd love to, talk to you, help you out, and create an individualized care plan for you.
Yeah, Sandy, it's always great to see you, and always thank you for your expertise.
Thanks, Sierra.
Yes, of course. And if you would like any additional information on today's topic, head on over to the hot links page on WNEM.com.